Hello, I'm Steve, co-founder of Fitness for 10 and Fitness for 5. Back here with Dr. Nario of Biointegrative Health Center. You can check them out online. Biointegrative Health Center is in Reno, Nevada, and they do a lot of great treatments and a lot of great work there. So welcome, Doctor.
Thanks, Steve, for inviting me again.
Sure, and so let's talk about medication nutritional deficiency side effects. So first of all, how would you define medication?
Well, good question, Steve. That's something that is definitely needs to be defined first before we move forward with it. So a medication is a substance that is used for medical treatment in a specific condition, hypertension, diabetes. And there are two types of classifications of medicines out there. One would be over-the-counter. This is the one that's available in the market, such as groceries, pharmacies, online, and you don't need any prescription for it. So examples would be your antihistamines, Benadryl for cough, dextromethorphan, even anti-inflammatories such as Tylenol and ibuprofen. The other one is a drug only obtained with a provider's prescription. So these are the medicines also being seen in commercials such as Humira. And the cool thing about that is when they say the side effects, it's just a big fast blur. So everybody just, what did it say? But that was the side effect of the medication that they're promoting. So those are the two types of medications that we see.
Yeah, they say that really fast. You know, if your head falls off, call your physician immediately. It's like, really? Right? I don't want to take that. My head might fall off.
And you don't even know it was mentioned through that commercial.
Yeah, so, and they say it so fast that, you know, your head falls off, call your physician immediately. If both your arms fall off after that, you better call 911, you know. So
hey, at least
okay, I'll keep that in mind, yeah. So medication side effects, what can that be?
Yeah, side effects, these are undesirable secondary effects, which occurs in addition to the desired therapeutic primary effect of a drug or a medicine. And yeah, I'll give you examples of that, like a Benadryl. So it removes your allergies, it calms down your allergies, but you're drowsy, you're sleepy. So meaning there's an attached side effect to it that, of course, who wants to be drowsy and sleepy? And it varies on depending on the disease, the age, the weight, gender, ethnicity, and even general health of the person who's taking it. And again, as I mentioned to you, Benadryl brings drowsiness. Tylenol, you will always hear about checking your liver and kidneys. It might damage them if you take it too much. And also, in this specific point of the discussion, I want to discuss that our discussion for today will be focused more on the drug-related nutrient depletions of these prescription medicines that we're going to be talking about. And this also, these medicines that we take, they can impair absorption of nutrients, leading to deficiencies, which are actually preventable. If we just know about it, we can prevent all these specific untoward outcomes. And a good example, again, would be the direct effects of kidney problems in relation to ibuprofen and NSAIDs can all be prevented.
Okay, so let's say someone's taken a statin or maybe a cholesterol medication. So you're saying that could cause a nutritional deficiency if someone's taking a medication like that. So talk to us about that. Someone's taking a cholesterol medicine. What do they need to be aware of as far as a nutritional standpoint, as far as their body?
All right, Steve. So the most common medication that you would hear about cholesterol medicines are the statin drugs. Anything that has a statin, simvastatin, rosuvastatin, pravastatin, these guys deplete CoQ10, vitamin D, testosterone, vitamin E, omega-3s, carnitine, zinc, selenium, copper, and vitamin K. So all of these things, hopefully somebody is taking a supplement in relation to the depletion that this medication does. So I want to make special mention of CoQ10. So when this is something that's related to muscle aches, I don't know if you've heard of that. When people take statins, they have muscle pains. Majority of this can be attributed to the CoQ10 deficiency that occurs. And 60% who are taking statins are actually experiencing this. And this leads to a big number of non-compliant patients just because of the side effect.
Okay, so what about some of the over-counter medications like antacid medication and that people can just go buy over the counter? Should they be concerned about maybe nutritional deficiency or something that those antacids are depleting if they take something over the counter?
Right. Well, with the antacids, the most common one would be proton pump inhibitors. So the names you'd be familiar with would be omeprazole, pantoprazole. These are the ones that will deplete your vitamin A, beta carotene, calcium, vitamin D, B12, iron, folic acid, vitamin C, magnesium, and protein malabsorption. The one that I want to emphasize with this specific medicine is the bone loss that's contributing to this. The reason for that is it lowers down the chloride in your gastric acid. And when this is low, there's also low absorption of calcium, meaning oral calcium that we take. Thus, the longer you are on this specific antacid, especially if you're on high doses of it, there is a higher risk for somebody to acquire hip fractures. And that's why calcium should be something that should be supplemented in these cases.
So another question I have is, diuretic medications. People, what things would people take that for, and what nutritional deficiencies could that cause?
Yeah, good question, Steve. Diuretics, most of the time we hear that for hypertension and even just mild swelling of the feet. They would take that. But you'll be surprised, diuretics are being taken by patients or people to lose weight because they have excess of water retention. And that's why they do that. But again, I discourage that just because you're not really treating the problem. You're just removing excess water in your system. The most common ones that you would hear would be Lasix or furosemide. And this depletes calcium, magnesium, potassium, zinc, B1, B6, and zinc as well. Yeah, I guess I mentioned that already. And the main one that I want to focus on here is magnesium. Anytime you're on a diuretic, it's actually promoting the removal of magnesium in your system, and it prevents the absorption orally and through the kidneys of the magnesium that you have. The thing here is when you have magnesium deficiency, symptoms such as muscle cramps and spasms, migraines, anxiety, insomnia, fatigue, blood pressure problems, heart issues like palpitations and arrhythmia, or rhythm problems, depression, kidney stones, and so many problems with magnesium. That's why if you are on a diuretic, make sure you have magnesium on board.
Well, it sounds like you don't want to be depleted of magnesium. And I mean, come on, I mean, I'm in the health and fitness industry. That's what I do. I'm not a doctor, but, anyone I think should be able to apply common sense and think that taking diuretics is not a good long-term weight loss program.
Right, there you go.
That's just, why don't you just cut your arm off? That's a good way to lose weight too, right?
Yeah, well, everybody wants a quick fix. So hopefully that's something that's ingrained in this interview, that diuretics are not weight loss medications or even supplements. I just want to emphasize that there are some bad side effects that goes along with it.
Yeah, you can starve yourself too, right? You'll lose weight that way, right? And keep it off, right?
You got tape on your mouth. Yeah, sure.
Sure. I mean, you starve yourself for a couple of weeks. All you gotta do is look at food, and you're gonna gain weight. So I got one more medication question. So diabetic medication, I think it's pretty common, and I mean, diabetes is, probably, I think diabetes too is from poor diet and so on, but diabetic medicines, what nutritionally, what deficiencies can occur when taking these medications?
All right, Steve. The thing here is the most common medication that you will hear a lot is metformin. And these are what we call biguanides, and depletes CoQ10, B12, and folic acid. The one that I want to emphasize with this one is B12, for the reason that when you take metformin, it actually impairs the absorption of B12, for the reason that it actually impairs what we call intrinsic factor. We need intrinsic factor to bind to B12 so that it can be transported through your intestines and be in your blood. The thing here is metformin impairs the creation of intrinsic factor. And the problem here is even withdrawal of metformin in relation to already having the problem of B12 malabsorption, there are only half of those that are going to be successful to bring themselves back to normal again in relation to getting that intrinsic factor reduction. That's why it's a flip of a coin. If metformin has done the damage, sometimes it can't be repaired. But that's why B12 supplementation, you wouldn't go wrong with it. And the thing here is, sometimes, yeah, that's the sad part. It may be permanent, it may be temporary. But B12 supplementation, you wouldn't go wrong if you're on metformin.
And I assume that some of these substances that you named are in multiple medications, right? It's like the main ingredient in different medications. Is that right?
Well, metformin can be taken by itself, and you're right. It can be combined with other medications. So you can get this as a prescription combined with the newer medications for diabetes. But it can come in a presentation of the metformin itself as a single drug or a combination in terms of adding other synergistic effects to lower your blood sugar.
Well, you know how I love talking about all these this nutrient stuff. So we thank you, Doctor. That's Dr. Nario, Biointegrative Health in Reno. You can look him up online. And so we will see you next time.
All right, thanks, Steve.